Parkinson's disease was first described by James Parkinson almost 200 years ago, and doctors normally think of it as an illness affecting the motor systems. So patients often go to their doctor first because they have a tremor in one hand, or they find it increasingly difficult to make movements, or the handwriting has become small, and the diagnosis is normally made from symptoms like this. However, patients also complain of more complex problems. So, for example, they might report an increased risk of colliding with things, or they say that they freeze up in confined spaces like a doorway or a supermarket checkout. And it's this last category of problems that we're investigating in our current study. It actually takes place in 3 different sites. One is the Royal Berkshire Hospital in Reading, where neurologists Professor Ralph Gregory and Dr. Salim Khan assess some of the clinical symptoms of our patients. For example, the extent of tremor in one of their hands and which side might be worse affected. The second place where the work's done is my lab at the University of Reading, where Jared Smith assesses some of the cognitive impairments in patients, for example, the problems with concentrating or in judging the direction of straight ahead. And we're now in the third site, namely the GATE lab in the Centre for Biomedical Engineering at the University of Surrey, run by one of the project partners, Dr. David Ewins. And the work here is done by Sonia D'Souza.
This is a movement analysis lab, so we're trying to find out whether narrow doorways or different kinds of wallpapers may affect their walking, and if they do affect their walking, whether it's for the better or for the worse, and how. We are also trying to put targets beyond the doorway to try and see if they might draw out their focus and help them to focus beyond the doorway and therefore not collide or freeze at doorways. We have cameras that are situated all the way around that capture data from people while they're walking. And the way it does that is we stick markers on people, and these cameras pick up the light that is reflected from the markers. Now all the data that is collected is sent via all the cameras into a computer system, and it converts from 2D into 3D data. We can calculate all kinds of variables of movement like speed, velocity, acceleration, stride length, cadence, and many, many more things.
There are a couple of things that have emerged already. One is that a certain subgroup of patients appear to show marked veering as they walk towards the doorway, and they can't center their bodies in the doorway, they move off to one side. And clearly such patients are at increased risk of collisions. So one thing one can do is point out to them that they fall into this subgroup, and they should take a special care when going through the doorway, moving to back towards the center rather than over to one side. So that's one kind of benefit that I think might stem from the research. A second one, and this is one of the hypotheses, is that the surrounds to the doorway might influence how much people freeze or hesitate as they approach the doorway. So one explanation for why freezing occurs is that the surrounds capture attention, so people can no longer devote sufficient attention to their walking if they have Parkinson's disease. If that's correct, then making the surrounds bold, say high contrast black and white stripes, should lead to more hesitation than making them much more sedate. Low contrast stripes or uniform wallpaper. And if this turned out to be the case, we could make some recommendations to patients themselves about how to decorate their homes, or to people responsible for the design of decorations in public buildings. We don't know that this is actually going to work out yet. It may not be a recommendation we can firmly make, but that's one of the aims of the project.